Good evening and a very warm welcome to our respected guest speaker, Dr. Pardeep Kumar Sir. Sir is renowned international speaker from Australia. I am Vaidya Yash Chaudhary, founder of Yasharth Veda Foundation, welcomes you all in this fifth webinar of Global Ayurveda Talk. Now, without wasting much time, I am handing to my co-host, Vaidya Bhumika Tambar. Over to you, Bhumika.
Thank you. Good evening, everyone present here. Thanks a lot, Vaidya Yash Chaudhary sir, for giving me this opportunity to introduce our fifth speaker of Global Ayurveda Talk from Australia, Dr. Pradeep Kumar Sir. Sir is Ayurveda Panchkarma and Complementary Health Consultant at Herbomiracle'z AyurWellness, Geelong, Victoria, and Australia. Sir is working from last 20 years in both clinical and academic field of Ayurveda. Sir is an international visiting faculty for the same to Shingan and Asian countries, Australia, New Zealand, Nepal, and many other places. This conference is in collaboration with our educational partner RGC pre-PG classes, Udaipur, expertise in AIPGT, AMO, and all other Ayurvedic exam, gifting partner Level Up Ayurveda, our associate partner Dharma Ayurveda Bhopal, and our international partner Herbomiracle'z AyurWellness Victoria, Australia. Now, without taking much time, I'm handing over to Sir. Over to you, sir.
Yeah, thanks a lot, Ms. Mumika. And Om Dhanvantrai Nama. Namaskar. Good evening to everyone present here. Special thanks to Yasharth Ayurveda and Veda for giving me the opportunity to share this platform. Especially hello to the young brigade of Ayurveda for attending the series of these lectures regarding global health talk. Why I called the word young brigade of Ayurveda, that mostly I think students are here, or who are internship students, or doing their internships, or completed their degree, or doing some diplomas or some post graduate courses. So the young brigade of Ayurveda, special hello to you for this global health talk. As what I think at this age, there is a zeal inside. Maybe you are in any field, that how I can fly abroad to explore myself, to work there, to settle there, to earn there for my better future, or whatever we people think about while sitting in India, as it was same in me at my time. And I hope so that was also there in all my colleagues and speakers of this global session. I may be wrong, but this was my inner zeal, and I think most of the people have the same. So, with the grace of Lord Dhanvantri Ji, we are very lucky being in the field of Ayurveda. Why I say this? Because most of the times after completing our BMS studies there, I taught also as a professor there for last 15 years in the Department of Basic Principles of Ayurveda in some renowned institutes in Punjab, my parent institutes and my native place. Why I'm saying this? Because after graduation, I also did my some practices in modern modalities under the supervision of some specialists in medicine, pediatrics, surgery, in different departments. But there was some inner zeal that our field is also there, which can be explored better. That is Ayurveda. So, with the grace of Lord Dhanvantri, being lucky in this field of Ayurveda, the traditional holistic healing system of alternative healthcare, first of all, with this zeal, we should be very clear about the basics of our science. I'm sharing these things before the startup of the main topic, because what we think, if there is a global talk of Ayurveda on the 9th Ayurveda day, and 9 countries are attached, and 9 different speakers are there for sharing their views regarding the global Ayurveda. What is the scenario of Ayurveda? What is the scope of Ayurveda? What are the organizations? What are the regulatory bodies? What medicines are available? How much eligibility criteria is there? What the strictnesses are there? What are the rules and regulations? What are the discrepancies? As I have also attended the last 4 lectures, so the questions are mostly same. And this is a common session that uh, it's audible?
Yes,
Hanji
sir.
sir. Yes, sir.
And you can code me in between if there is some problem. And so we should be very clear. If we think like this way, that we have to go abroad and we are thinking and attending these sessions, that we have to practice there, earn there, settle there for the better future of our families or whatever related with us, we should be very clear, first of all, with our own science. We should be having the deep knowledge of our granthas. We should have thorough knowledge and deep understanding of our spiritual text related to the body, mind, and soul, as well versed in our text that Shrir Indriya Satavatam Sanyogedari Jivtam. In last four lectures of our international speakers, I regard them about their lectures also. Mostly the same things are there in all the lectures. And they have also said, our last lecturer, Dr. Prashant Tiwari, also shared the same thing, that everywhere there is a talk of the body, mind, and soul. That may be India, that may be Australia, New Zealand, Switzerland, or some Scandinavian countries, that may be your European countries, or some Mid Asian countries, Malaysia, Thailand, everywhere, most of the places, on the name of the Ayurveda or Panchkarma or alternative therapies, if we have to practice in our field, we should be very clear about the body, mind, and soul concept. That is Shririndriya Satavatam Sanyogidhari Jivtam. Also about the main code of currency of our human body, of our human systems, as well versed in our traditional pattern. That same thing again, Doshdatu Malmulam Hi Shriram. That is the main Ayurveda. We have to balance our doshas. We have to be clear about our sapt dhatus. We have to clear about our three malas. That is the Vata Pitta Kapha, or Ras Rakta Mas Medasti Madhya Shukra, or that may be your Oj, or Pranas, Ojas, or Tejas, or your Mutar Purish and Sved. Along with these main two concepts, body, mind, soul, Dosh Dhatu Mal, we should be very clear about the important concepts of Ayurveda. Like Dr. Prashant also told, again, the Panchbhautik Chikitsa they are practicing in their South Korea, and Shadrasa approach, and your Agni concept, and of course, along with that, your Guna protocols, Ahar Vihar concept, or the Tri Sutra Ayurveda, or your Hituling Oshad, and many more, especially Prakriti Prikshnam, that may be physical constitution or your mind constitutions. On the other side of this, also the structure and working of our cells or tissue systems, that may be we have gone through our anatomy and physiology with the prakriti vikriti portion in shape of rog vigyan, that is the pathological concept of our this Ayurveda. Dravagam concept, our Bashajya Kalpana part, is the other important part, and especially the Jara and Rasayan Chikitsa for practicing abroad in these countries as geriatric care. Now, coming to my own journey, after graduation BMS from Punjab in 2002, I started practicing under the supervision of the modern modalities in some metro cities of Punjab, and started my own practice there, the 10-bed hospital with emergency care in medicine, pediatrics, with some specialists in MD medicine, MD pediatric there. But there was some zeal inside that we have to go to our field where we can flourish at our own. Nobody will be our bosses. We will be our own bosses, as there is always the desire of everybody. Then I did my Panchkarma PG course, which was PGPP, Postgraduate Proficiency in Ayurveda from Telka Ayurveda College, Pune. During that, I did some yoga certificate course also from Yog Vidyadham Nasik. And by luck, I got admission in PG in Siddhanta and Darshan in College of Ayurveda, Bharati Vidyapith University. And I got very good guides there. And I started my approach there. As I told before MD, I did the modern practices with some supervision of the super specialists in allopathy field to explore my integrative approach. At that time, we joined some Ayurveda organizations, Vishwa Ayurveda Prishad, Nasya came later. I was also a Punjab president at the start, and some NEMA, National Integrative Medical Association, because everywhere people were practicing mostly the allopathy part. We started something integrative approach with Ayurveda, with allopathy. Slowly, the allopathy practices got reduced, and allopathy Ayurveda part came up. After academic courses, again same topic as the today's topic, my zeal of globalization of Ayurveda came up, and I started thinking to shift abroad, where I can flourish myself as a Vaidya in my own field. Here, I want to share very important one thing in my journey of Ayurveda, that at the start of PG in Siddharth and Darshan, I thought I will take my topic as globalization of Ayurveda. And I taken that topic. I completed the abstract and other formalities and the CDs and the other formalities to for the selection of the topic. But by default, my dear friends, that topic was not selected. That has not passed through the our refined educational curriculum, as I was told that Ayurveda is already globalized. What you will do new? Because at that time in 2005, there was something in my mind that as a student, that we should go abroad, and we should see what type of authenticity is there. If there are only the massage centers, if there are only the local superficial procedures, if there are rooms only on the name of the colleges of Ayurveda, or people are just working in different modalities on the name of Ayurveda, and what type of products are there, what type of companies are there. Like there is a quest of you people today that was in my mind at that time. So I chosen that topic, globalization of Ayurveda, but that was not passed. And then I chosen some other topic, other subject that my study was in my PG, that was the mind constitution, with special reference to its subtypes with service study. Then I chosen that topic because I was attached with some abroad countries with through my childhood friends. Mostly they were abroad, and they went there doing their engineering degrees and other stuff. And I was also interested to go there with their company, for their company and all that stuff, and seeing their lifestyle, as we all know that they are enjoying and this and that. But again, my inner sense always ignited me for the same, to go and see. I was seeing that there are very much mental stress abroad also. So I chosen that topic, mind constitutions with service study, and how to read the mind, how it is related with the economy, how it is related with your professional development, how it is related with their food and lifestyle. Then, while these all things, while my academic career, I came back with my PG and started job as a assistant professor, as a lecturer in my own parent institute in Punjab. There I got a opportunity to join some more companies, some more associations, some more organizations for the propagation of Ayurveda. Then came the main journey, and I started traveling to some Asian countries for the propagation of Ayurveda. I visited Nepal also as a speaker, international speaker through NASA platform, and Pooja Kohli was also with me at that time. And then got a break to visit Schengen area, especially in Holland, Belgium, France, Germany, Italy, and Swiss also, Austria, in some other countries in the Schengen area for the propagation of Ayurveda. Seeing there people are practicing Ayurveda, foreigners are very enthusiastic about these pathies. They want to learn what is the Vata, Pitta, Kapha, how the food and lifestyle, how what type of Indian food can be started, how the vegan protocols are there, where no animal product can be used. And I was again interested while coming back from Europe, my tour in 2016. I started making my own venture. And with the grace of Lord Dhanvantri, again on the first Ayurveda day, that was 28th of October 2016, we started our venture as Herbomiracle'z AyurWellness Clinic with the Panchkarma facilities there, with the trained doctors and staff in India. That was 28th of October 2006, the first Ayurveda day, where patients started coming from abroad for their various ailments for their swasthya rakshanam. And of course, the other part of our main aim of Ayurveda for the Vikar Prashamnam. Before COVID, in 2019, I visited Australia and New Zealand to explore Ayurveda field possibilities here and some better future here for the same. So I visited here and I seen, oh, there is a very good scope. There are a lot of practitioners sitting here legally under the, we can say, as a naturopath field, complementary health therapists. And practicing Ayurveda is a bit better here than other countries. Then COVID came. I came back to India, started my practice again. My academic journey was continue in regular practice. My practices were there in Panchkarma therapy. And but with the help of my childhood maid and his immigration agency, My Visa Guide, and Australia and India, I started my Ayurveda journey after post-COVID travel relaxations. I came here on PR pathway directly, approx 1.5 years ago. I am not a very much big entrepreneur, but here with the local guidance of practitioners who were BMS, some MDs were here, some are having some Panchkarma diplomas. They have very good clinics here. I started my journey here. It was a bit hard at the start, 1.5 years back, as we can't code ourselves as doctors. We can't code as we are doing some diagnosis of the patient. We are treating somebody. We are using some medicines because it is on the name of the wellness. As I started my wellness practice here also on the same name as Herbomiracle'z AyurWellness. Here I got a opportunity to get attached with some yoga studio, and they given me some space because they were also enthusiastic about our science. Before that, before starting my practice, I want to share that we have to get registered with some local organizations which regulate Ayurveda system for practice, like the best is AAA here, which is called Australasian Association of Ayurveda. ANTA is here, Australian Natural Therapies Association. ATMS is here, Australian Traditional Medicine Society, and some other organizations are also here, which are regulated by the government. But we are not completely registered practitioners, but we are registered with them, these organizations who regulate our Ayurveda. Your eligible degree of BMS or MD or diploma in any field related to Ayurveda from some recognized institute of universities under Ayush system, under NCISM, whatever the facilities are these days, managing our degrees there, are valid here for registering yourself for membership of these organizations to practice in future, as they have their own eligibility criteria for the professional membership for practicing in Australia, especially. What are their eligibility criteria? You have to be your valid work visa. Valid visa to come here. If you are not on the PR pathway, you should have some work permit. Like these days, immigration rules always change. I don't know much about that field. I know about my journey only. There is some new visa has came, like a holiday visa or work visa, or some changing criteria are there for working eligibility here. You should have valid visa with the work permit. You should have what assess. What assess is what you have. Your degrees should be assessed. Whatever you have done, that may be BMS or MD, your assessment of your degrees or internship by government agencies here. That may be with the help of the immigration agencies, or that you can directly do online if you are in IT sector. Assessment of your experience in any academic or clinical field, if any. Your expression of interest to come here. Your assessment of mark lists or any other qualifications. Along with that, you should be having some PTE or IELTS, that is the competitive level of English. At my time, it was for the criteria 7 each, the 7 bands in all the segments of these modalities of competitive level of English. These days, I think it is 777, 8, or whatever. These gets changing. Then, while coming here for the membership of these organizations, you should be having some first aid certificate level course or some other courses like CRP, that your CCP, or some short courses, manual handling or medication training, which are very short courses of 1 day or 2 day or short, very easily available with the for the local safety of the clients, or to avoid some negligences or to avoid some discrepancies. Then, with all these formalities, you apply for the provisional membership of these organizations. Once you get provisional membership, you get some code or some account to apply for the professional indemnity insurance, which again, see, the rules are very strict here. The life in Australia is very disciplined. There is no chance of mistake. As in India, we say, okay, this is your first mistake. Okay, we will see next. No, we should be very clear. So I started my topic that we should be very clear with deep knowledge, with deep understanding of all the things. It is not very easy, but nothing is impossible. After fulfilling these and having professional indemnity insurance, which companies are providing, that you will be safe if there is some negligence or there is some discrepancy at the 11th hour, for your safety or for your staff safety, for that. Then, after getting the professional indemnity insurance, you again apply to these organizations and they give you some code, then some certify of the decision. Then you have to complete 100 hours of training at some local clinics in your own field with special Vadyas, under the supervision of special Vadyas who are BMS or MD, who are our seniors, mostly we know them, who are coming from India or Sri Lanka or some other places, who are having eligible degree in Ayurveda. Then you should also have to submit some 10 case reports after the 100-hour clinical practice there. Then they provide you the membership account after filling their due fees to practice independently. We did this, I did this, all other people who are practicing here, they have did the same protocols. There is no partiality, there is no referral, there is no we can say special whatever is there in India, that I can approach and you can be spared from something. That here is equality in all fields, so and no preference to anybody. So at the start, when I came here, taken all these things, completed all the formalities like other people do, Australia is that expensive country. I'm not discouraging you people, but I was also from the mediocre family. What to do at the start? Other field of workspace to combat your expenses are here, like some recreation centers, some yoga centers, some spas, saunas, naturopathy clinics, some occupation therapy centers, some physio clinics or chiropractor clinics or aged care facilities. I was a bit lucky because I was having my own practice in India from 15 to 20 years, and some people were visiting me from these countries also, which I met them here also, and I got little bit support from them also. In these modalities, in these workspace places where you can have some job with related to Ayurveda or some of these modalities, and with some local small short courses, which is not too hard to go through. Now, if we are coming to point, after completing all these formalities, getting professional membership, you are starting your wellness clinic or startup, or taking your own place on rent, or sharing with somebody else in some other modalities, like mostly people start up with the yoga studios, giving some volunteer lectures in your own community, or with the help of some other NGOs or organizations. It starts very slow. Now come to the point, our tools, how we have to use, as we are talking about the body, mind, soul, Shri Indriya Satavatam Sayogodari Jivtam. We are talking about the Dosh Dhatu Malmulam Shriram. There comes the food and lifestyle. How we treat. First, we can use our Ahar, Ashtavidi Ahar Aitan rule. We can use the Ahar Vihar Roshan part, the first two things, the Ahar and Vihar. We can guide the people for the right food, some dietetic changes, for some lifestyle changes at Vihar, which gives very good results here. Now, if we are coming to Ocean part, which are our tools main, the herbs. The main question is herbs, how the herbs are available, how the your any ras these are there or not, how the companies are approved there. So there we can use the herbs which are locally manufactured and TGA approved. Sorry. Listen, my friends, I am repeating my word TGA approved, which is the Therapeutic Good Administration, is a local body which regulate the safety measures for these things, and the combo of the herbs to use should also be having TGA approval, the Therapeutic Good Administration, with a labeling on them as AUSTL means listed in their list, or AUSTR means registered with the TGA, which some local companies also started providing to the local practitioners who are registered and eligible to use. Single herbs are there, some products are there, Brahmi Grith is there, Sukmar Sham is there, Ruga Vardhani Vati is there, some herbal oils are there, Nasya oils are there, Karnapurna oils are there. Local people also purchase some of the OTC products over the counter at their own, like curcumin, Vidhania, Valerian, Tagar, or Brahmi in chemist warehouse. This is here available in all the suburbs, which are also again TG approved, locally manufactured and locally packed. Our community, Indian community, we can say, or from other countries, Asian people, they also purchase these things online or from some Indian stores or from some Asian stores where herbs and other ready products, I will not quote any name of the company, are available on the name of the food supplements. But we can't prescribe them in writing to use. And also they have to take care, the clients who are purchasing them, they have to take care of themselves before using. As per the quote, we all know in Hindi language that Neem Hakim Khatra Jaan, as rules are very strict here for all these type of malpractices and counters as easy illegal. Because, you know, we can't say them, this is for that, this is specially for that, you can take that. Because here, let it be, we are using our kitchen herbs, which are the mostly the main tools of our practice. We can use them as food products. We will try to code them specially as a therapeutics, that we know all. We can't openly say it, that we are where we are using the black pepper, where we are using the curcumin or haladi. And we have to be very crucial about our words, like I told at the start of the lecture, that we can't say diagnosing the people or treating the people, or we are using some medicine or the particular term. We can use our terminology and very openly. Local companies are making some herbal oils, as I told already. Especially the next thing I want to share, Ayush government is playing a very great role in globalizing Ayurveda all over the world. Especially one MOU was signed in recent years in Western Sydney University and All India Institute of Ayurveda, AIA, or the AIIA, Delhi, for research work in Ayurveda here in Australia. With the luck and with the grace of Lord Dhanvantri, Dr. Raja Kapalaji, the professor in Balroga, our senior faculty, has been appointed as International Chair of Ayurveda for the same, which is a ray of hope for better future and scope of Ayurveda in Australia in coming years. Am I audible there?
Yes, sir.
Okay. And so more and more institutes, more and more companies, more and more organizations are approaching day by day to Australian concerned departments for MOUs regarding more growth in the concerned field. Um, I think I have covered most of the topics. Any questions still, Yash?
If any delegate is having any question, then they can directly ask in the comment box.
Or you can ask directly to me as by reading that, because I think comment box is not coming here.
Yes, sir, I will. Sir, is Ayurveda is recognized as a medical practice in Australia?
See, I have told that medical word is not for the Ayurveda part, as it is regulated by the organizations and not as registered. You see, there were also some funds where the practitioners are get reimbursed. Other modalities like acupuncture, chiropractor, even the physiotherapy, even the remedial massages. But Ayurveda directly is not covered. Earlier, some companies were there who were reimbursing these things, and that was counted directly under the naturopathy. But as we say that we are medical practitioners, this is not possible. But we can practice here on the name of Ayurveda under naturopathy as a complementary health therapist, as I also came directly on the peer pathway in the same category.
Sir, is any additional degree apart from BMS or MD is required to practice Ayurveda in Australia?
There, I already told you that BMS degree is too much for us. If we are postgraduate, we have some thorough knowledge about the same. That will be very good. If we are having some other diplomas that are very good. Here, local, one thing I want to share, there are some registered uh, training organizations also, there are 5 6 colleges which are providing some courses to the local people who don't have BMS or who don't have MDs or other diplomas from India or other countries. For local practitioners, what they do, they provide 2 courses here. One is diploma in Ayurveda, herbal medicine, and one is diploma in lifestyle, and other is advanced diploma in herbal medicine. But that is the small courses of 1 year, having some weekends there, or 2 years. That is registered here, the course. But I think if we are BMS with the thorough study of 24/7 for 5.5 years with internship and all that stuff with some local practices, this is too much for us.
So there is one question from the delegate. So what are the procedures that you follow to reach Australia?
I clearly mentioned that also, that we should be having eligible degree, and we should be having some work permit or some peer pathway, because this is actually the question for the immigration agencies. As I came directly on the peer pathway on some as a complementary health therapist, I did my VATAS, has completed my eligibility criteria of the professional organizations here. What was the eligibility there? As already some doctor in the earlier lectures were explaining that Google Auntie is there. You can Google that also, because what is the criteria to come here? I can't guide about the visa, but I shared my journey that we came here as a complementary health therapist on the peer pathway, or some new visas are there, like holiday visa, or some lottery system is there that particular people will be getting some holiday and work permit together for 1 year or 2 year. But there are different criteria at different ages to come to Australia.
Sir, can we open Panchkarma center over there?
See, dear, we can do Ayurveda practice, and as other speakers also told, we don't do sphere practices like Vamna or MSs. Of course, other procedures are mostly done here. Abhyanga, Nasya, Karnpurna, Matravasti, Kativasti, Janubasti, whatever the procedures, the Udvartana or Akshitarpan, even they are covered under the professional indemnity insurance also. Of course, they are Panchkarma centers, no?
Yes. Sir, can you please tell about the medicine supply chain or exporting regulation required?
See, I told you that all the things which are coming from overseas, they should be TGA approval, rapid good administration, like FDs are there with the manufacturing or their strict use. As these people in Australia, they are very much clear about their residents that they should be safe from the intoxication of some substances like maybe lead, maybe some other things. So they want, if the products are available here, they are manufactured here, they can be used. Earlier days, some companies were providing from some Kerala, like some good companies, they were providing their medicines here. But from 4 or 5 years, the rules are a little bit more strict. They want that there should be no intoxication. Our residents should be safe. As I told you, that curcumin is available, local manufactured, grown and manufactured and packed. Curcumin is there, ashwagandha is there, tagra is there. The name of the medicine comes on the chemist warehouses as a sleep pill. And ingredient is tagar. There are some detoxificants, some combos which are locally available and locally manufactured.
So what's about the physician associate career after BMS in Australia?
Can you repeat it?
Sir, what's about the physician associate career after BMS? We
Position
can work as a
associate.
physician.
Pardon?
We can work as a physician over there.
See, we are independent Ayurveda practitioners. The name you can say, but we can't say ourselves as doctors, because doctor's word is for the medical fraternity only. We can't directly code ourselves. We are treating, diagnosing, or giving some medicines or prescribing some medicines. We can work as complementary health therapist, as alternative care or palliative care. We can't directly code that we are doing something surgically or we are curative. We can't claim anything here. Hello? Hello?
Yes, sir.
Yes.
Sir, is there any Ayurvedic institute
Yeah,
in
I told
Australia?
you, yes, there are institutes which are providing some local courses, because if we people here, mostly the people are having some Ayurveda degrees or diplomas already who are attending this. My seniors may be also there. Here are some degrees, here are some diplomas, small diplomas, which are for the local people. We are already have done that very rigorously. We have studied that already as a single subject. We have studied 6 subjects in a year or in a profession, first prof, second prof, third prof. And I think that is the more deep study. But here the courses are not on pre-course, that for the international student. But if somebody want to do that, they are a little bit expensive here, but they are for local practitioners who don't have some other degrees. The foreigners do that, and they are also then eligible for doing the local practice after fulfilling the criteria of the organizations, as I told.
So can we do Agnikarm or Vidkarm?
No, directly you can't do that things. I told you that other modalities are there. For acupuncture people are there. Chiropractor people are there. You can't do these procedures till date. In future, hope so. I don't know. After the research or some evidence-based practice from India or with the help of the Ayush government is doing a great role in this, and we hope so. It is a more better future. With these days already, it is much bright. People are earning their bread and butter from Ayurveda, and it will be more better.
Sir, as nowadays hemp and cannabis is in trend. So
Yeah.
is it legal in Australia to practice?
Yeah, I have not seen too much, but I think some companies are using these products, but I'm not too much clear about this.
So there is one question from the delegate. Sir,
Yeah.
as you mentioned that the government of India and Australia are now working together for research project.
Yeah.
Sir, other than that government of India, what is the scope of research in Australia regarding Ayurvedic drug and principles?
See, as I will quote here that Dr. Prashant was telling, they are doing some research in South Korea. No? At their own, they met the government. See, here I already also mentioned that Australia is a bit expensive. See, if earlier days the medicines were coming here, what TGA says that we have to follow their rules. We have to go through their research protocols to approve our drugs. But that is too much expensive. See, big companies are there. I will not take any name. You all know that these days what the products we are using while sitting in India from the Ayurvedic companies. Even they are thinking they are all already in process with the government here, with the TGA authorities here to pursue their research work. That is bit more and more expensive, which is I can't think at my level. I think so, but they are under process. They are going on.
Sir, is Ayurveda practitioner will get PR in Australia, and what's about the process?
I already told you that directly you can come on the peer pathway, or people come here and they're doing their practice, and if they are eligible only. So we have to think about it from India only. And also, if some students are coming and they are on the behalf of the Ayurveda, or they are taking some master's degree in other fields. Some people do what after BMS, they do some fields like psychology, where people go for nursing, the people go for community health services, public health sector, social work, or you can say some allied health sciences, other. And then according to the student visa, as a master's degree or some health administration degrees, and they can apply accordingly with the rules and regulations of the peer pathway.
Sir,
After completing their after their point system, like in other countries, completing that criteria.
Sir, there is one more question from the delegate. Is it good to come Australia by taking nursing course or other courses like MBA or any other course like MHA to practice Ayurveda?
If I am in Ayurveda, I will be preferring Ayurveda, and I will motivate you people all. This is a very good field. Everyone needs this, and there is much, much, much better scope of Ayurveda here, and in every country. People, it is their own zeal. I told you already very clearly, my zeal, how to fly, how to, do these things. People can come, but I think again there is a long journey. They will be coming as students. Getting what I want to say? They will again take 4-5 years to get PR. Then they will be eligible for the PR or some other settlement of them. If you are coming on the behalf of Ayurveda, you are directly practitioners here. After fulfilling their eligibilities, they can do MBAs or MHA or whatever.
Sir, is VMS is enough, or we have to do MD or master's degree after that?
I told you BMS criteria is enough, and master degree, of course, in our science, the PG in any modality will be increasing your knowledge. Will be easy for you for doing practices here on the behalf of the food and lifestyle.
So is Ayurveda practitioner eligible to run a Panchkarma clinic in Australia? They can set up their own?
Yeah, of course. I told you already. People have very good centers here. They are earning a lot, doing a legal practice. But the word legal, TGA approval, rules and regulations, very much discipline is the need of the hour.
Sir, PR is necessary, or we can pursue our career without it, like on the other visa, like holiday visa or study visa or any?
Study visa is a different criteria, because when you will be coming on the study visa, taking some other modalities here, and you will be having some working hours, there you can use your study of Ayurveda, your degrees, but you have to fulfill for working in the field of Ayurveda the eligibility criteria of the local organizations who regulate the Ayurveda system.
If there is any more question, then you can directly ask in the comment box.
How is the work culture in Australia? Is Komal? I think work culture, I told that people are working here good in Ayurveda. How many
So there is
working
one
hours?
question from.
How many working hours?
Recently,
That
I
depends
connected one
upon.
teaching institute in India. They told me that we have no chances to come there after PG. Is it true, sir?
Pardon? Can you repeat,
Recently,
please?
she connected one teaching institute in India. They
Okay.
told that they don't have any chance to come after their PG. Is it true?
No. What you want to say that after PG, you can't come to Australia?
Yes, sir. He's asking about that.
No, 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 no. I told you that criteria. You should be having some eligible degree from some good universities there, and you are allowed to come here. But the immigration rules, I don't know. I am not specialist in that. You have to ask from your some special immigration agencies or some agents for the same. Job
Yes, there is one
opportunities.
more question from the
There
delegate.
is one question, very good question. Job opportunity. I told you, yes, that there are job opportunities in some other fields related to Ayurveda or some health modalities, but also some good Ayurveda centers. If they need some therapist or some other people as a staff, sometimes they sponsor also for the Ayurveda people. Sometimes they hire also. Here also, I have seen some BMS graduates working there as a job for doing our Ayurveda procedures.
There is one more question.
Uh,
How does Desh and Kal affect the level of treatment and method of treatment?
Deshan call is very much important. I told you that again, same protocols, our Trivid, Shadvid, Dashvid, Priksha, and Deshan call, the northern and the southern hemispheres are different only. If Here is the now summer season has started and their winter season has started. According to that, it counts. And call accordingly, we are 5.5 hours ahead and in these days in summer and 4.5 hours ahead in winter, and that of course affects, but then there is nothing like that, oh, here is the snow all the time or raining all the times. Seasons are a bit easy than other countries like in India, but that is opposite. Like there is winter and summer in India, and there is summer and winter in Australia, like that. There is one question that if there is some academic teaching for ourselves. Yeah, of course. If some people here do some local courses like PA, that is training and assessment, and in education in the same field, then you can have some workshops, or so you can do some events to guide some local people, like people do here. Our Ayurveda consultants, our Ayurveda practitioners, like they do Abhyanga workshops, some Shirodhara workshops to guide local people. That is eligible. But the certificates giving them or the other things, they can't be having some medical legal aspect. Thus, that is there for their own knowledge.
Sir, it's necessary to register under any association in Australia to practice.
See, yes, it is good to having get registered for your safe side. People do practice also if they are having some PR pathway or some valid work visa, or they are citizens after applying that later in later years. But it is good to be attached with some local organizations, especially AAA and other things, because you will be knowing about the upgradation. You will be safe with the sporting team of the president and the local people, the secretary, and you will be attaching their whatever the events or workshops or latest updates. Like I told you that our international chair of Ayurveda, Dr. Rajagopal sir, also takes some webinars through the AAA, and we have to attend that, because for practicing we have to complete some CBD points also every year, like 20 to 25 points after attending some seminars or webinars or face-to-face workshops, for continuing our professional membership for practicing Ayurveda in Australia. Sir, at your side, one question is there. I think we have to practice in India or in Australia. I'm already told that it is the interest of the individual, like no fingerprints can be matched. Same is the zeal of your inner sense, that where we have to go. Of course, home is home. We always miss that. And if somebody is strong in emotions and he should explore themselves, everybody is doing the same. Can we practice in allopathy hospital? It's mandatory to join. Not complete question. No, if we are Ayurveda specialist, and we can practice in our field only. For allopathy, you have to do the local medicine degrees or whatever the criteria. Is there any exam needed for practicing in Australia? I told you already that we have to be the eligible criteria of the local organizations only after your eligible degrees.
Sir, I think all the questions are completed. Now we have to pack, if you allow.
Yeah, of course. I'm open to any question or whatever, any confusion that can be repeated also.
So there is one more question. Can we
Yeah.
prescribe someone medications? Can we do someone chikitsa over there?
Which one?
Sir, can we do someone chikitsa in Australia?
I told you, yes, what is Shaman Chikitsa? Shaman Chikitsa is very simply using the herbs. And of course, if the herbs are eligible here and to practice and TG approved, we can use that, of course.
Sir, herbs are easily available in Australia.
Not easily available, but we have to see that which are the Australia listed or AUST labeled, and that is a bit hard to having a lot of herbs. TG approved herbs are there. There is some list, and that we have to find and online and sometimes to some good companies. Single herbs are available. Combos are very less here. We can't have some asavarist, some gold preparation. We can't use some other or too much rasaushadis. We can't use even not simple rasaushadis. We can't use. We can use some simple herbs and some local combos or some blended oils or at the start level.
Sir, Indian brands are available.
I told you that in Indian stores some things are available, but which are not legal to use as a therapeutic part. They are available on the name of the food products, food supplements. They can be used. People are using that already, but we can't prescribe them. We can't guide them. Okay, in writing you can take that or not as a Ayurveda practitioner.
So can we make our own medicine?
Of course, with the single herbs, you can, which are locally registered, which are locally PG approved, you can take that. What you have to do, you have to take herbs, but you have to mention that on the label. When you are giving that, what is the ingredient inside? Then you have to maintain the data of your own. What you have purchased, whatever is left, and what are the billings.
Sir, we have to take permission or any license for the manufacturing.
We are not manufacturing like that, but we can't sell that in the market. Now you will be using that for your own patients only, and in our practice we don't do that. Mostly that we will be making it in bulk. If we are seeing the vata pitta kapha of the patient or the pulse diagnosis or the jiva priksha, then we will be deciding what we have to put accordingly in the same.
Okay. On behalf of our Yasharth with the family and all the participants, I would like to thank you, sir, for your valuable time and support. It means a lot to us. Thanks a lot, sir.
Thanks a lot, Yash, and for your foundation, especially Pooja Kohli ma'am and other seniors and my colleagues here. Jai Ayurveda.